Alopecia areata is a common autoimmune disease causing sudden hair loss on the scalp, face, and sometimes other areas of the body. There are different levels of alopecia areata severity. The three main types of alopecia areata are patchy alopecia, Totalis, total hair loss on the scalp, and alopecia universalis, total hair loss on the body. An alopecia areata diagnosis depends mainly on the history of hair loss. In addition, how the hair loss presents, looks is different according to the type. You may see small round or oval patches of hair loss on the scalp, eyebrows and eyelashes, beard or other areas with body hair loss and regrowth at the same time in different areas of the body, significant hair loss in a very short period hair loss that's mostly on one side of the scalp instead of both sides. There are different alopecia areata types or forms, causing varying amounts of hair loss. It most commonly begins as isolated patchy hair loss. Terms used to describe alopecia areata are patchy alopecia areata, which causes one or more coin-sized, usually round or oval, patches of hair loss on the scalp or other places on the body that grow hair. This type may progress to more severe forms of alopecia areata listed below, but most commonly it remains patchy. Alopecia areata totalis, a type of alopecia areata that results in hair loss across the entire scalp. Alopecia areata universalis, the most severe type of alopecia areata that results in hair loss across the entire body, including eyebrows and eyelashes and body hair. Diffuse alopecia areata, a sudden and unexpected thinning of the hair all over the scalp. It can be hard to diagnose because it looks a lot like other forms of hair loss such as telogen effluvium or male or female pattern hair loss. Ophiasis alopecia, a term that describes this pattern of alopecia areata hair loss that occurs in a band along the sides and back of the head. With all types of alopecia areata, hair loss and regrowth can be very unpredictable and cyclical, happen over and over. For some people, hair may even regrow and not fall out again. Even though alopecia areata causes hair loss, the hair follicles remain alive. This means it is possible to regrow hair, even after many years of hair loss. Fortunately, there are now effective, FDA-approved treatments that block the immune system attack on the hair follicles and allow hair to regrow. While there is no cure for alopecia areata, there are treatments that may regrow hair in both adults and children. The kind of treatment your doctor recommends depends on the type or form of your hair loss, the severity of hair loss, how much hair you have lost, your age, what you have tried already. If you also have an atopic, allergic condition, such as atopic dermatitis, eczema, not all treatments work for everyone, and finding the right treatment for you can take some time and patience. But there is new hope for people with alopecia areata. Since June 2022, the Federal Drug Administration, FDA, has approved 3 medications for a severe disease, and researchers are studying many other potential treatment options. Common treatments. For mild or limited alopecia areata, people with mild alopecia areata decide not to have any treatment. Instead, they leave it as is or use different products, such as scarves and hairpieces, or camouflage techniques like hairstyles to hide the affected areas. However, if you do want to try treatment to stimulate hair regrowth, here are some of the most commonly available treatments. Topical corticosteroids. Corticosteroids, or steroids, reduce inflammation around hair follicles, helping hair grow. Corticosteroids are often combined with other treatments for alopecia areata. Topical corticosteroids are a common first choice for children or for adults who can't have injections. See below closing parenthesis. Intralesional corticosteroids, the most common treatment for adults with patchy alopecia areata is intralesional, injection of corticosteroids, meaning injection within the bald patch. A very fine needle injects the medication into the areas of missing hair on the scalp or face. Some find the injections painful, while others feel only slight discomfort. If the injections are successful, you may see new hair growth within 6 to 8 weeks. You can repeat them every 4 to 6 weeks, stopping treatment when the hair regrows. If there is no regrowth after 6 months, your physician will likely stop treatment. Corticosteroid injections don't prevent further hair loss. Some people develop temporary depressions or dents, called dells, from the injections. Minoxidil oral. Minoxidil comes as a tablet in 2.5 milligrams, 5 milligrams, or 10 milligram strengths. Although some studies have shown that low doses of oral minoxidil on its ONF helped hair regrow. It is most often used in combination with other treatments, such as intralesional corticosteroids or JAK inhibitors. Topical minoxidil is generally not effective on its own for extensive hair loss. However, some healthcare providers might prescribe it in combination with other therapies. Common treatments for moderate alopecia areata for patients with moderate disease. Treatment for alopecia areata may include topical corticosteroids with or without topical or oral minoxidil. JAK inhibitors may be recommended in some cases of moderate alopecia areata. See more details on JAK inhibitors in the section on severe alopecia areata below. In addition, there are pulse corticosteroids. Pulse corticosteroids are corticosteroids given at a high dose at regular intervals over a short period of time. The pulse corticosteroids are typically given by mouth. Oral steroids cause side effects like weight gain, thinning bones, osteoporosis, rising blood sugar levels, and high blood pressure, among others, and cannot be used as a long-term treatment. Pulse steroids appear to have fewer of these side effects. Topical or contact immunotherapy. Topical immunotherapy, also called contact immunotherapy, is generally used to treat more extensive alopecia areata, but may be used for moderate disease. As well, the immunotherapy agent causes an allergic rash, allergic contact dermatitis, where it is applied. This changes your body's immune response around the hair follicles. Though researchers don't understand why this promotes hair regrowth, the rash can look like poison oak or ivy. The immunotherapy agents most commonly used include squaric acid, dibutyl ester, SADB, or difenciprin, DPCP. There are reports that 40 to 55% of patients experience significant regrowth. If hair regrowth is successful, treatment usually needs to continue to maintain the regrowth. The treatment can be uncomfortable, causing redness and rash where it is applied. Topical immunotherapy is typically performed and prescribed by dermatologists. Dupixent. About 1/3 of people with alopecia areata also have atopic dermatitis or eczema. Dupilumab, Dupixent, is a monoclonal antibody that is FDA approved for treating atopic dermatitis in adults and children as young as 6 months. Dermatologists may prescribe Dupilumab as the first-line treatment for alopecia areata for people who also have atopic dermatitis or a family history of atopic dermatitis. Learn more about research studies on Dupilumab as a potential treatment for alopecia areata in these webinars. Treatments for severe alopecia areata. JAK inhibitors. After decades of no new treatments, Janus Canis JAK inhibitors have renewed hope for people with moderate to severe alopecia areata. JAK inhibitors are immunomodulatory drugs. They target the immune system pathway that is overactive in alopecia areata. Immune cells and hair follicles interact through cellular mechanisms that utilize Janus Canis proteins or JAKs to transmit signals in the immune system. By taking a JAK inhibitor, the immune cell attack on the hair follicle is blocked or inhibited, allowing the normal hair growth cycle to continue and hair to regrow. JAK inhibitors are considered the first-line treatment for severe alopecia areata, including Universalis and Totalis. Dermatologists may also use oral minoxidil and/or intralesional injections with a JAK inhibitor. Immune cells and hair follicles interact through cellular mechanisms that utilize Janus Canis proteins or JAKs to transmit signals in the immune system. By taking a JAK inhibitor, the immune cell attack on the hair follicle is blocked or inhibited, allowing the normal hair growth cycle to continue and hair to regrow. Olumiant. In June 2022, the FDA approved the JAK inhibitor baricitinib, Olumiant, a daily pill for adults with severe alopecia areata. This is the first time the FDA has specifically approved an oral drug for this disease. Olumiant was first approved in 2018 to treat rheumatoid arthritis. Clinical trials showed that 32% to 35% of patients with extensive alopecia areata who took Olumiant at the 4 mg per kilogram dose had hair regrowth covering 80% or more of their scalp after 36 weeks of treatment. Longer-term studies showed that hair regrowth continued over time with Olumiant treatment. Some people showed a delayed response to treatment initially but achieved hair regrowth over a longer period of time. After continuous treatment with Olumiant for 2 years, 104 weeks, 90% of patients had hair regrowth covering 80% or more of their scalp. Litfulo. In June 2023, the FDA approved another JAK inhibitor, Litfulo, for the treatment of severe alopecia areata in adults and adolescents ages 12 and up. Litfulo is the first approved treatment for individuals under the age of 18. Litfulo is an oral medication taken once daily. In a clinical trial, treatment with Litfulo was significantly more effective in achieving hair regrowth to 80% or more scalp hair coverage compared to placebo. Leqselvi. In July 2024, the FDA approved a third JAK inhibitor, daroxylitinib, Leqselvi, for the treatment of alopecia areata in adults 18 years and older. Leqselvi is a new oral medication that is taken 2 times per day. Leqselvi was tested in 2 large placebo-controlled phase 3 clinical trials and more than 1,200 patients with at least 50% scalp hair loss. In one of the clinical trials, about 1/3 of study participants receiving 8 milligrams of Leqselvi twice daily for 24 weeks achieved 80% scalp hair regrowth, compared to less than 1% of the participants taking placebo. If the video is informative, then subscribe the channel, like and share, and press bell icon for more research-based informative videos.